Plus, Whoopi found out the hard way that how you care for your teeth has a huge impact on your entire body. So, a dentist is telling you what you need to be doing every day and how serious the health consequences can be if you don't. All that, hot topics, and more coming up live on The View.
I learned the hard way that ignoring your teeth can cause big problems to your overall health. I don't want you to end up the same way that I did. So here to help us sort all this stuff out is cosmetic dentist Marc Lowenberg, who's also my dentist. Just in the shortest way possible, tell them what happened to me, what you found.
Well, you suffer from what over 50% of all Americans suffer from, which is periodontal disease or gum disease. And what happens is from years of neglect, from not brushing your teeth and flossing regularly, from eating Coca-Cola cake and then not brushing your teeth, it affects your gums and the bone that holds your teeth in. So if you look at the way your teeth looked 20 years ago, let's say, about the time that you did Jumpin' Jack Flash, you had a great smile. You know, you had a slight space between your two front teeth, but basically your teeth were even and you had a great looking smile. Well, over the years, from not taking care of them properly, it affects the gums and the bone that holds the teeth in, and you find that your teeth start moving. So the space between your two front teeth got bigger because the bone deteriorated and the teeth moved out.
Okay, so that's something that most Americans are probably either facing or going to.
Over 50% of Americans have some form of periodontal disease.
Okay, now in terms of products, if you want to talk about prevention, there's so many, Marc, that I don't even know where to begin. In terms of, what do you need to have in your medicine cabinet? Is it the electric toothbrush? Is it the regular one?
The first thing you need to understand is what you're trying to do. There's bacteria in everybody's mouth naturally, but that bacteria, if it's not cleaned off, forms something called plaque, which is a sticky substance that sticks to your teeth.
Those are not my gums.
No, those are not.
Okay.
But the white area represents this plaque or the sticky bacteria that sticks to your teeth, and that causes gingivitis or an inflammation of the gum tissue. So in order to get rid of that plaque is the enemy.
Right.
We want to knock that out. You need basic tools. First of all, you need a toothbrush. I like a soft bristle toothbrush because it flexes and it bends and it gets into all the nooks and crannies that you need to get into.
Right. Okay.
Secondly, you need a good toothpaste. Now, if you don't have periodontal disease, any toothpaste will do the trick. But if you do, you want to find a toothpaste that has tartar control or ingredients in it that will fight the buildup of plaque. Dental floss.
Yeah, the floss.
Everyone hates the dental floss. It is so important because the plaque that sticks to the outside of your teeth, where you really can get to it, also stick in between the teeth. And if it's not removed, that bacteria is going to destroy your gums.
Are those little sticks that you can get now, are those as effective?
You could use those stimulants also, but really nothing is better than floss. And it doesn't even matter what kind of floss you use. It's the technique that matters, which I'm going to show you a little bit later.
Okay.
Tongue scraper. Lots of people do not take the bacteria off their tongue. You could buy these tongue scrapers that just pull down on your tongue and they remove the bacteria from your tongue. And if you don't want to use a tongue scraper, you can use a toothbrush and brush your tongue.
Brush your tongue.
And last but not least is an antiseptic mouthwash that's going to help kill the bacteria that causes the plaque.
So don't go for like the pretty version of mouthwash. Go for the one that's meant to kill the bacteria.
It's not about the taste. It's really about killing the bacteria.
Can you explain what are the first signs of periodontal disease if people are wondering could they have it or not?
The first thing you have to realize is what healthy gums look like. Your gums look pretty healthy, by the way.
Oh, you'd be surprised.
Healthy gums are pink, they're tight, they're flat.
Okay.
But periodontal disease...
Healthy gums? What's all that green on the side?
This is not my, those are not my teeth, right?
No, not you.
But gingivitis... Gingivitis starts with a redness in the gums, a swelling of the gums, or a bleeding. How many people have bleeding gums and they ignore it? If your eye was bleeding, you'd run to a doctor. But people
bleeding
think
when you floss or just bleeding
when you brush your teeth, you brush your teeth, it bleeds. That's a sign of gingivitis. Or even if you bite into an apple and you notice that your gums start bleeding. That's not okay. It's not good health.
So what about, if you're brushing, sometimes it could be they could bleed because you're doing it improperly. So what's the proper technique?
If your gums are bleeding, if your gums are bleeding, it's because you have gingivitis. You have an inflammation in the gum tissue.
So tell us then how to brush properly for everyone, especially if you do have periodontal disease.
Everyone has to brush the same way. The easiest way of brushing your teeth is taking the toothbrush and placing it on a 45-degree angle so that it actually angles up towards the gum, because the plaque sticks to the tooth at the gum line. And you brush in segments of your teeth, like 2 or 3 teeth at a time. You brush back and forth, vibrating the brush. You have to brush the outside, the inside, and the chewing surfaces. And guess what? Most people brush their teeth, they don't look in the mirror. You have to look in the mirror and make sure you're cleaning the teeth properly. If you're just sticking the brush in there, you don't even know where the brush is
Well,
going.
let me ask you, you know, there's a lot of different toothbrushes, some that vibrate and do all kinds of stuff.
You mean electric versus manual?
Well, yeah, but some
that
are
have
meant
timers
to,
on there?
yeah, some are meant to do different things in terms of brushing. Instead of you doing it, the thing goes like that. Does that loosen the teeth? Is that good or is it bad?
It definitely does
Doesn't
not loosen
matter.
the teeth. The thing is, if you're good with your hands and you use a manual toothbrush properly, that's great. But if you're not, a lot of people are not good at it. The electric toothbrushes, they have heads that vibrate just the way you're supposed to do by hand, or there are heads where the bristles rotate. The idea is to clean all the plaque off the teeth, and you have to do whatever you have to do to accomplish that.
How often are we supposed to come in and see you? How often do we see our dentist?
Well, normally, the average person goes twice a year.
You are.
I recommend that my patients come 3 times a year. Whoopi's got to come 6 times a year, but minimally 2 times a year.
Yeah.
It's like a relationship.
It is a relationship, but here's the thing that you absolutely have to know before we go. Everything that he's talked about, you can do. Everything that happened in my mouth was preventable. I brought it on myself. I had perfect insurance, I had the money, and I didn't do it. You can. So, think about it. When we come back, we'll be back. That's what I know.